The federal government is proposing new hurdles and restrictions for immigrants, including access to temporary status for medical treatment. At the same time, there's a new campaign at the State House to allow driver's licenses for unauthorized immigrants. To bring us up to date is our guest from the Mass Immigrant and Refugee Advocacy, or MIRA, coalition. We'd like to welcome the Director of Communications, Marion Davis. Thank you very much for being with us, Marion.
Thank you so much for inviting me.
I want to start with the thing that seems to be most in flux here, and this is about the medically deferred action. People from other countries who need some very serious medical treatment. A lot of them do come to Boston for that. What is happening with that now?
So that has been an absolute mess. U.S. Citizenship and Immigration Services stopped accepting applications, or rather started doing blanket denials as of August 7th. They didn't issue any kind of announcement. They didn't say they were going to do this. They just started quietly sending form letters to lawyers. And eventually enough of those piled up that lawyers started talking to each other and advocates came together. And I'm actually kind of proud of the fact that it was Boston that really brought this to the forefront, because it was the Irish International Immigrant Center called us, and we put together with other groups, we put together this press conference on Monday a week ago that ended up blowing this up as a national story. And we've been very fortunate because the fact that all this attention came to the issue actually led the government to at least partially reverse its decision. So they said now on yesterday that they are going to be reopening all of those cases. They have not yet said whether they will consider new cases in the future, which would be really bad because people fall mortally ill every day. But for the people who were terrified that they were going to be sent home in the middle of some kind of very serious treatment, they don't have to be in fear for now, and we're very relieved.
Yeah, explain, because the life and death part is really the heart of this. What does that mean for people who are here or trying to get here?
So, well, for the people, the medical deferred action is something you can only apply for when you're already here. And what happens a lot of the time is people are traveling here, maybe they're on a tourist visa, and sometimes they come here already sick because they wanted to get treatment. Other times they come here and something terrible happens to them while they are here. And then they go to the hospital, they get diagnosed, and the doctor says, you can't safely return home because you need very specialized treatment that is not available in your home country. And there are some of the people that are affected by this are coming from countries like Honduras or Haiti, where there's really the access to good specialized care is very limited. And so those people then can apply for the special status for themselves or for a family member. A lot of the patients are children, and the people who are applying are their parents to be able to stay with them and be able to work and live here legally while the child is receiving treatment.
Well, in Boston, we practically take pride in being a medical mecca for the world. But what about the rest of the country? Is this exactly what you would call a floodgate for immigrants coming into the United States?
Not at all. We don't know the exact numbers because this is not something that the government provides, but they have said to journalists that about 1,000 applications get processed per year. That's nothing. That's, we have 44 million immigrants in this country, so 1,000 in a year is really a trickle. And it is really because it is a very hard thing to get. You can't just be somebody who has, pneumonia or something like that and get this. This is for people who have extremely severe cases, very rare cancers or cystic fibrosis, or, there was a story in the New York Times of a woman with a very, very rare disease that causes dwarfism. That's the kind of people who are getting this.
Is there any dividend for the rest of us in America that people come here and get this kind of treatment, especially in Boston? I mean, does this do anything for our science or our ability to respond to crises down the line?
It may, in some cases, add to our science, but for the most part, it's also about, with great power comes great responsibility. This is about, we have the best in the world, and it should be an honor and really a point of pride for us that people from all over the world and not just from nearby seek our health care. And it is also about just the kind of country that we want to be. We want to be a country that expresses generosity, and just like we have foreign aid, just like we have various humanitarian programs, to be able to provide a little bit of hope for these extremely desperate people seems like just the right thing to do.
This is BNN News. We're talking with Marion Davis from the MIRA coalition. Marion, the federal government is trying to also raise the bar on government assistance for people who are in that pipeline to citizenship. There are some new disincentives around that. at least if they're taking effect. What should people expect right now?
So public charge has been one of this is called public charge, and basically for a long time, for actually Massachusetts has the not so proud history of having pioneered this term, which was basically there's long been a policy that if you're somebody who's going to come here and just be dependent on the government, who's going to not be able to pull himself up by his bootstraps, then you're not welcome here. And that is a public charge, as a person who depends on the government. So there have been different ways of defining that over the years. For the last 20 years or so, it has been basically a public charge as a person who relies completely or mainly on welfare payments, or who is institutionalized at government expense. And what the Trump administration did is they redefined public charge as anyone who receives quite a wide range of benefits. It includes, nutrition assistance, and it also includes Medicaid, and includes subsidized housing, and a whole bunch of things. And they say if you receive this for certain number of months over a 3-year period, then you would be disqualified. But the thing is, it's not retroactive, it's forward-looking. So they say, are you more likely than not to receive this at some point? So that's one of the trickiest parts of this whole rule, is that the vast majority of people who are going to be subject to the public charge test, who are getting green cards, don't actually qualify for any of these benefits. But when they look at them and are you more likely than not in the future? And that's going to be mostly a measure of their income and of their health and of the size of their family, and that's where they get them.
Also coming up is a hearing at State House on driver's licenses for people, including unauthorized immigrants. Some people out there might be saying, how can we give them official IDs if they don't all have the right to be here? Why does that make sense?
Well, the truth of the matter is undocumented immigrants are driving in Massachusetts every day. Not all by a long shot, but many, because it is physically impossible to get around in much of Massachusetts without a car. And so what we're saying is, rather than create the situation where people cannot legally drive, give them an opportunity to come forward, prove their identity, take the driving test, show that they know the rules of the road, get insured, and be driving safely. And we believe that that would be beneficial for the whole state. And it would also really be transformative for immigrants who right now live in constant fear of getting caught driving, or else make incredibly hard life choices to not drive.
Thank you very much for being with us. From the
Thank
MIRA
you so
Coalition,
much.
Marion Davis.